Bismillah ar-Rahman ar-Rahim. Today we shall discuss safety and side effects of resmetirom in clinical practice. In the previous lectures, we discussed when to use resmetirom and how to use resmetirom in fatty liver disease. Today is talk about its safety and side effects. Resmetirom should not be used in patients with liver cirrhosis. Studies are being conducted, but still data is not published yet. Hopefully, when the data is available, we may be using resmetirom in the cirrhotic patients as well, but till date, no data available, so it should not be used in patients with established liver cirrhosis. Second group is that of pregnant ladies. So again, resmetirom data is not available and it should not be used in pregnancy, and the same is for lactating mothers. Similarly, in the pediatric age group, data is not available, so its use is not recommended in pediatric age group as well. What about the adverse effects? We can divide the adverse effects into two, those less than 10% and those more than 10%. Those more than 10%, these include diarrhea in 23 to 33%, nausea in 15 to 18%, ALT more than 3 times in 11 to 13%, AST more than 3 times in 9 to 12%, and those with less than 10% side effects, pruritus 6 to 10%, vomiting 7 to 8%, constipation 5 to 8%, abdominal pain 5 to 7%, and dizziness that are 4%, and AST more than 5 times in 1 to 4%, and total bilirubin more than 2 times in 1 to 3%. So these are the decreasing reporting of the side effects. Diarrhea is the most common one, and total bilirubin more than 2 times is the most least one. But remember that these are mostly in the initial months or weeks of the resmetirom therapy, and as the resmetirom therapy continues, these side effects, they fade away. And the least one is again the ALT more than 5 times normal. So I thank you all for being with me during this series on resmetirom, and I hope that these lectures have helped in the understanding of using resmetirom in a proper way to our fatty liver disease patients populations. Take care. Khuda Hafiz.